Now to give his thoughts on this important subject of productivity growth and the future of the American economy, we'd like to welcome Aneesh Chopra, who is Chief Technology Officer of the Department of the Office of Science and Tech Policy of the Executive Office of the White House. Did I get that title right?
Whatever.
Okay.
It's all good.
Thank you.
Thank you very much. Well, let's give him a round for the remarks this morning, for the love for the presentation. Just a brief word before I get into the remarks. I joined public life in 2006 as Virginia's Secretary of Technology. One of my first homework assignments by Governor Kane was to serve on the Council on Virginia's Future and to help lead its efficiency and effectiveness effort. And clearly the question was, can we bring productivity growth to the public sector, in our case, the state government? I was fascinated by the fact that the federal government had stopped measuring productivity, so I didn't actually know what the goalpost was. And it was only but for a quote that Lenny had in an op-ed in California, where you estimated something on the order of 1% productivity gains could translate into significant benefits to the public sector. Suffice it to say, we in Virginia launched a productivity measurement system at Virginia Performs. For those of you that care about that kind of thing, vaperforms.virginia.gov. And I'm very hopeful that the productivity dialogue, which is enhanced by today's report, continues to influence our policy making. I want to provide perhaps a bit more of a narrower look at productivity from the lens of technology and innovation. I don't come to you this morning with a full a whole of government view on productivity, but rather the work we're doing to harness some of the challenges and opportunities that we see. I actually, to get to the headline, believe your little presumption of GDP growth on regulated sectors is an underestimation, and I'll give you my argument momentarily. So let me just set the stage. The President, in September of 2009, unveiled a strategy for American innovation. That strategy was revised in January to reflect the President's introduced budget. And it is this strategy that I think speaks to the opportunities of productivity growth in the economy writ large and for the public sector more specifically and narrowly. Without providing you a broad overview of its entirety, let me just hit the highlights. The President believes that our investment plans should focus on the building blocks of American innovation. What we're saying, Austin Goolsbee at the launch of this a few weeks ago talked about this as the seed corn, that America should not be eating its seed corn at a time of this fiscal environment, that we should find a way to continue to make the investments in long-term economic growth. And that seed corn investments include our research and development activities, the President's commitments to move the rate of college attainment to the highest levels in the world, our goals on infrastructure. So we'll hit some highlights in that area, but we are fully aligned with these as critical ingredients. We also believe that we need to have the rules of the road promote market-based innovation. That's why we launched our Startup America initiative, and more on that in a minute. But it's also about getting the framework right. The President called for a simplified, expanded, and permanent R&E tax credit. And we're also looking to modernize our patent system so that we can harness the IP-based sectors of the economy, which we think contribute mightily to our overall growth. And last but certainly not least, we need to catalyze breakthroughs in key sectors of the economy. I was just taking notes on your slide. Advanced manufacturing, we think, has tremendous opportunity in areas of modeling and simulation. The government sector clearly needs to see a modernization plan, and we've been very active on that. The healthcare sector, you'll be hearing about momentarily, and the educational sector. All four are right in the area where we need an all-hands-on-deck approach. It's a little bit of government policy making. It's a little bit of academic research and scholarly R&D activity. It's a little bit of private sector ingenuity and entrepreneurship. It's large and small corporations coming together. It's an ecosystem around productivity gains and new product development that is at the heart of that third pillar. So let me do a few minutes on a few highlights here that we believe are critical to that long-term equation, and then I want to talk about the method by which our government is operating to achieve those objectives, because I think that's relevant. This conversation is not just about the policy in words, but it's the execution approach, which we think is equally important, if not more so, to get the results. So, On infrastructure, I thought I'd highlight one of the president's leading initiatives coming out of our State of the Union address, where he laid a vision for winning the future by out-innovating, out-educating, and in this context, out-building our economic competitors. The president last week traveled to Marquette, Michigan. I had the chance to visit with him, and we announced our wireless infrastructure and innovation initiative. On the surface, this spoke to the issues of access and equity in the American economy. The president called for investment incentives to ensure that 98% of the American population could get access to this very important and powerful infrastructure. But that's not all. The president also identified a $3 billion innovation fund to ensure that the American wireless infrastructure continues to lead the world and serves as a platform for the next generation of internet-enabled products and services that will fuel the economy. This is not just about taking an existing technical footprint and scaling it, although that is part of the equation. That's what we're calling our 4G footprint. But it's about leapfrogging towards 5G and beyond. And it's very important as you look to America's infrastructure and its competitiveness that you ask the questions, where are we in our innovation engine on this third wave of internet-based economic growth? What are we doing to build the networks of the future that take advantage of spectrum in new and creative ways, that have security and reliability under adverse conditions as core design features of the network architecture? We're putting $1 billion into basic research in DARPA, $1 billion into experimentation and tax credits, and $1 billion in application development in public sector priorities. $500 million of that will go towards our public safety community, our first responders. You know, we're all carrying our cell phones, our smartphones, but visit a cop, a firefighter, a first responder from the emergency medical community. Those guys are still using analog radios. Okay, you cannot deliver productivity gains unless you provide and equip the key stakeholders in our economy with the tools of the 21st century. It is absolutely time, 10 years after 9/11, that we build the technical architecture so that our first responders can harness the potential of that which we're seeing in our commercial lives. We've just got to close that gap, and we're committed to doing it. But, to the point that we just heard momentarily, we also included allocations of R&D funding to ARPA-E for smart grid technologies to modernize our utility sector, which is a very analog system. To modernize our learning system, $100 million for our, to a new program called ARPA-Ed, which is a new framework for delivering what DARPA has done for defense for education. $100 million in healthcare to the new Medicare Innovation Center to think about breakthroughs in mobile health applications that will transform care delivery. $100 million in our infrastructure sector, namely our transportation sector, to modernize our railways, runways, and roadways, empowered by this new IT infrastructure, the 4G and beyond wireless piece. So we think of infrastructure writ large. It's not just scaling what's known, but it's designing the innovation engine in a manner that gives us the leading edge potential for applications in the sectors of the economy that need that productivity gain. It's about ensuring that we're harnessing new technologies more creatively in the government itself. It's one thing for us to be calling for the country to be more innovative, and another for us to sort of be demonstrating quite the opposite in the operations of government. I wanted to share a brief story. The National Science Foundation in 2007 received an unsolicited proposal by a professor at UC Santa Barbara to think more thoughtfully about how cloud computing could influence private organizations that may not be willing to use, say, for example, Amazon Web Services for sensitive information. They said, can we design a system that has the scale efficiencies of the cloud, but the security and protections of a private ecosystem? He was successful in less than 2 years translating his basic science and research that came out of the NSF grant into a working prototype. And it was NASA that said, we will be your beta customer. And they successfully adopted it and called it Nebula. In 1 year, NASA Nebula had been so successful, my colleague, the chief information officer, decided to scale it and have that infrastructure serve as the backbone for the president's signature open government program, usaspending.gov, that he called for when he was a United States Senator. So 2007, it's an idea in a professor's brain. 2 years later, it's a working prototype in beta partnership with the government. And now it's at scale. You can see it through an open collaboration. Look at openstack.org. The technologies in this program and more generally, the government's commitment to breakthroughs and innovations in cloud computing are active in a collaboration with the private sector because we want to turbocharge this industry. Yesterday, my colleague, the Chief Information Officer, announced our cloud-first policy that will direct agencies to move at least 3 services to the cloud over the next 18 months and has identified over $20 billion of IT spend in the federal government that are capable of taking advantage of various cloud service permutations. So it's about eating our own dog food in delivering on these productivity gains. It's about open government. In Startup America, an initiative we've launched to catalyze entrepreneurship activity led by Steve Case and Carl Schramm of the Kaufman Foundation, a nonprofit that's outside of the government, catalyzing new opportunities to scale what works to promote entrepreneurship and innovation, marrying that up with a policy framework that simplifies rules, opens government data, convenes around industry standards. We believe the potent combination of Startup America and our response to support entrepreneurship can lead to breakthroughs. An example, the Alford brothers. They found out that the Labor Department has data on the 401k management fees employers pay when they administer their plans. And it's a written document. You can get from the Labor Department a Xerox copy of each person's plan. Each company submits like a 50-page plan, and you got to pay 10 cents a page. You can imagine that data isn't all that liberated. It's sitting in file cabinets. What these guys said is, wait a minute. By the way, show of hands, how many of you know what your employer pays in 401k administrative fees? Anybody? Show me your hands. Come on, where's the love? Where's the love? Sure you do, liar. Nobody does, because it's not transparent. Well, when these guys got the data, and in the president's open government directive that he issued on day one, you can see we went from paper submissions where they had to Xerox files and pay 10 cents a page to the Obama way, electronic access, machine-readable formats. They've now got 90% of all corporate assets, all because they've gotten it electronically from the Labor Department. Anyone can get it, by the way. It's all freely available. What did they find? If you're in a small business whose assets under management are under $5 million, you're screwed. Your management fees can be as high as 10% of net asset value. But if you work for McKinsey, you're probably paying no more than 1% in asset management fees. They estimate this to be a $4 billion drag on retirement accounts for those who happen to work for small businesses. How does that factor into productivity growth? What's up? Transparency. By freeing up the data, by allowing entrepreneurs to think of new and creative products and services, mark my words, you're going to see that number come down, because if anything we've learned about transparency and market dynamics, there'll be more competition to bring those fees down, more dollars in the pockets for retirees in working for small businesses. No change in law, no fancy government program, just openness and a lot of entrepreneurial goodness. It's about catalyzing breakthroughs. I want to give you an example in healthcare because it's an important case study, because we're going to run this play in energy, healthcare, and education, to say the least. What's the story? The American healthcare system today rewards volume. You're a doctor, you're a hospital, you provide a service, you get paid. So the IT and support services, the productivity question, optimizes against those conditions. So we've got great software for billing and great software for scheduling to make sure that you can see more patients and that you can get paid for the services you render. What we've done in the Affordable Care Act, and maybe this isn't as popular as other topics during the political heated debate, but from just the tech and innovation perspective, we've created the foundations to shift the healthcare system from paying for volume to paying for value. There are 4 policy levers that were in the law: patient-centered medical homes, accountable care organizations, bundled payments, readmission rates, and most importantly, a new Center for Medicare and Medicaid Innovation that is funded and charged with breakthrough payment models to focus on quality and value. And here's the secret. if the independent actuary at the HHS machinery certifies that the pilots and programs, the payment models, are value accretive to Medicare. The authorities sit within HHS to scale that payment program across the country. In other words, we have the tools to align payment to value. Now imagine, what does the healthcare delivery system look like when you pay for value, not volume? All of a sudden, there's a market for data mining and analytics to understand who are the high-cost patients and how much you better care coordinate for them. Care integration tools, decision support, technology to extend the physician's time and energy, how to engage consumers in new and creative ways so they actually take the meds that you've prescribed. Once you create the market conditions for these innovations, your measly little presumptions of economic growth in healthcare will be dramatically overshot because the entrepreneurial sector will build new products and services that drive to the value equation, not the volume equation. So we see great potential. That's why at the JP Morgan Investor Conference, folks like John Doerr and Eric Schmidt and others predicted that we will see several new billion-dollar industries doing nothing but providing IT-enabled services to these new organizations that benefit from the payment models that reward value, not volume. That's how we transform sectors in a collaborative model that relies emphasis on entrepreneurship and innovation, but geared towards the right set of incentives. It's about a methodology in how we are running the technology, data, and innovation perspectives on behalf of our president, because he has said he wants to change the way Washington works. Traditional models of output in Washington are program budgets and new laws. These are sort of what we traffic in. But we believe on the tech sector, there are three under-leveraged policy levers that have, I believe, productivity growth potential. Number one, more pre-competitive R&D collaboration. Number two, open data. And number three, voluntary industry-driven consensus standards. You combine these technology policy levers with new tools to engage the public, and we believe, I call it results-driven ecosystems. You might call this productivity juicing goodness. Right. Let me just give you an example in each, and then I'll wrap. In the area of pre-competitive R&D collaboration, a year ago March, we funded 4 research centers that are focused on applied R&D in healthcare information technology. It was funded out of the Recovery Act. One of our grantees was a Harvard team that proposed something radical, the SMART platform, substitutable medical applications. One of the difficulties in bringing innovation to sectors like healthcare is that the IT infrastructure, for lack of a better term, stinks. You've got fragmented islands of data in proprietary formats. And if you wanted to build any value-added service or application, if I'm an entrepreneur and I want to create a care coordination tool, how do I actually connect that to a hospital information system? Each time I go into that product, I have to, for 50x the cost of the development of the product, I have to actually build one-off connectors to get my system in place. It is a significant barrier to innovation. What our team at Harvard said is they can develop a platform layer that sits on top of any legacy system and would have a common opening so that application innovations built to the open platform could then be dramatically lower in terms of cost and complexity to execute against any of those legacy systems. In other words, you don't have to rip and replace the fragmented systems we have in America. You have to adopt this open platform, and then new applications can build on top. 1 year to when we awarded the Harvard grant, because of pre-competitive R&D collaboration, they have all the major private firms in healthcare IT on their board, and rock stars like Clay Christensen and Regina Hertzlinger. 1 year to the day they got the award, they will publish their first application programming interface in one of the modules in medication management, and will announce a $5,000 competition prize for the best new application that plugs into the module that can prove this hypothesis. So this is about rough consensus, running code, application development, not a bunch of academic studies for study's sake, delivering on the promise. That's why we launched challenge.gov, to kind of spur and encourage more of this collaboration activity, a lot of it born out of our R&D coordination with universities. It's about frugality as a new business model for running government itself. I share with you the story of New York City's 311 service, which is an amazing customer service innovation. You got a pothole in New York City, you dial 311, you let them know, or on your cell phone you text it in, and they've got an application that allows them to monitor it and be held accountable for fixing it. Mayor Bloomberg has delivered tremendous service improvements because of this initiative to engage the public. But it's not cheap. $45 million in fiscal 2010 alone. How will the average city, state, community adopt and replicate the New York City model? In traditional government programming, you would say we need a funding mechanism to subsidize the have-not communities so they can benefit from the haves that have this kind of capability. And you'd see this massive subsidy for billions of dollars to scale this $40 million tool so that everybody benefits. Because you know what? We all deserve the ability to report our potholes and have them fixed. But in our innovation approach, it's about going after the verbs, not the nouns. I'm sure there's a lot of goodness in their $45 million budget, but at the end of the day, they had some basic workflow. Someone sees a problem, someone reports it, there's transparency for the world to know that it's been reported, and there's a mechanism to ensure that the issue is solved. Meet Maynard, Texas, a town of, 15 or 6,000 people. They didn't have, the same person that runs IT picks up the trash on Fridays, right? This is not a heavy overhead management structure. They used an open web platform called See-Click-Fix, a whopping cost of $38 a month, and they've replicated the functionality for voice, web, and mobile options to report your pothole, or in this case, your grass needs cutting in a park or something, and having it transparent for folks to react. Does it have every bell and whistle in the $45 million project? Of course not. But does it deliver the kind of concepts that we've seen here? Yes. That's frugal engineering. Look at the verb, not the noun, and iterate and innovate around the verb. The problem we're trying to solve is the transparency problem and the citizen engagement problem. One can essentially create a market of substitutable goods. Last policy lever I referenced was the issue of standards. Now, I want to share with you a quick story, again in healthcare, because it's an area we've been really focused on for the last couple of years. We heard public testimony from a physician who said, I'm a primary care doctor, and I love that you're doing this healthcare IT program. We've got money in the Recovery Act, and we've got an initiative to wire the nation, and it's a sort of a fairly extensive program. And he said, this is all well and good, but I have a patient that's moving from Virginia to Arizona who's asked me to email her medical records to the new doctor in Arizona. We have the same software package, but the software doesn't have a button that says email. So there's no mechanism to get the record out. And we can't use regular email because it's not secure. So the quandary was, what are you guys going to do about this problem? I said, that's a remarkably simple question. And I turned to my colleagues and I said, what is our answer? Our answer was voluntary industry consensus standards processes. March, whatever the date was, 3rd or whatever it was, of 2010, we launched the Direct project. We paid for the wiki and a project manager, and that's it. And we said to the private sector, you have 90 days. Report back the technical specifications for safe, secure email. And guess what? It was religious warfare. Some wanted SMTP, some wanted SOAP, some wanted a RESTful approach. But they achieved consensus. Small vendors, big vendors, everybody in between. Every single person had a voice. There was no backroom, cigar smoking, what have you. Everything was done in the open on the wiki. 90 days later, they decided to build a reference application. 25,000 lines of code, open source, shareable by all commercial vendors. And I'm pleased to report 90 days after that, the first commercially supported secure transaction was delivered between Hennepin County Medical Center in Minnesota and the state health department to send immunization data that's required on a daily basis. By using the standards protocol, The hospital, the vendor, the recipient saved 90% on the costs it otherwise would have taken to set up that communication string electronically, because in the old model, you'd have to have a point-to-point interface. IT has to get involved, someone has to code, program, it would take weeks, months, what have you. By adopting this framework, the vendor in question was able to get it done in 5 hours for a one-time setup fee of $495, and they can communicate. What is it? Wouldn't you know? 2 weeks ago, when we announced the success of this initiative, 3 vendors have already announced nationwide capability to support this protocol. A protocol that did not exist in nature a year ago.
Since he's got to leave at 10:30.
So I just wanted to share with you, when you engage in voluntary consensus standards, you can open up and break down barriers and bottlenecks to innovation. Imagine what you're going to do now if you can safely and securely communicate in healthcare. While we have some strategies in Washington to make a difference, you're going to see grassroots level innovation in ways we could never imagine. People building applications on top. Literally, this blog post a physician had, I wish I put the link in there, he described how now he can email to patients through Microsoft Health Vault a secure copy of the patient's medical record emailed to them. You couldn't do that before without feeling concerned about whether that was safe and secure. And he describes how he's going to go about doing this. Final observation. This is about a new methodology of running our government. I talked about our productivity and economic growth strategy on the Strategy for American Innovation. I've ended with this philosophy of how we wish to execute this using the policy levers that are perhaps a bit more nimble and oriented towards results and rapidity. And that's engaging entrepreneurs as problem solvers. And we're running this play across the entire government. In smart grid, in transportation, in areas like that, a protocol for common standards to report that pothole, we are engaged in any and all dimensions. Thank you for hearing me out. I look forward to a couple of questions and getting you back on your program.
Please join me in thanking Aneesh Chopra. I think your remarks fit in perfectly with the theme of the day, particularly because you developed productivity increases in the so-called laggard areas discussed in the report, like government and healthcare.
And education.
Education.
Yep.
And as the grandson of people from Maine or Texas, I have to congratulate you for getting the name right.
All right.
If Maynard has gone high-tech, then there's hope for all of us.
Yeah.
We've got about 10 minutes for questions before Aneesh Chopra has to leave. Please wait for the microphone to reach you before you ask a question. Yes, there in the back.
Or here in the
front. In the front then.
I'm Mitzi Worth. I'm with the Naval Postgraduate School. This
Oh,
was
great.
an absolutely fabulous
In San
presentation.
Diego?
No, Monterey.
Here. Okay.
But I'm here in Washington. This is the single best story I have heard from the entire Obama administration.
Oh, my.
And I want to put you. No, I'm serious.
No pressure.
No, I'm serious. I'm
Boss
serious.
is pretty good, so please be careful.
No, he's not. He
Oh,
gets an
gosh.
F- from me because he
Okay.
doesn't explain things so you can understand them.
Okay.
And I really want to get you on the road so we can understand the good things the administration has done. Because just saying, well, I mean, if you watched him on Jon Stewart, when Stewart asked the president, what have you done? He said, well, we've done health care and we've done finance, and then we've done all these other things nobody knows anything about.
Oh, is there a question here?
Yeah.
My question is, how do I get you on the road
Thank you.
sharing this story? The other question I have, which is sort of related to the earlier one, was how does productivity as a metric relate to jobs?
Well, let me answer the second one first because it's out of my swimming lane. I'm not an economist, nor would I play one on TV. And I think the discussion that you've introduced today really is a myth-busting discussion because the current theory of the case has always been the concerns that productivity is often defined only as getting more value for the input submitted. So, the formula kind of indicates a lot more about doing more with less. And I think the part that's missing is how innovation and new product introductions factor into the productivity model. So what we're learning today is there's a methodology to incorporate new product development and innovation into the equation. And I think one of the things I like about the tech sector, just to kind of describe on the productivity question, is that this platform economy deserves some study. McKinsey Global Institute. What I mean by that is, it is difficult to know the marginal value of the smart platform. Assume it's adopted by 10% of the American healthcare system. The fact that it's made new product introductions frictionless. What is the net value of having installed this sort of barrier removing asset and a platform for growth? We are experimenting with this in government procurement. DARPA is thinking about how to create a marketplace for innovative apps to support warfighters in Afghanistan and Iraq. It's a program called Transformative Apps, and it's a sea change in how we think about doing traditional spec-based procurement to platforms for creativity and openness, where there are some rules to get into the market, so I don't know if you could think about platforms as the segue between productivity and new product introduction and opening up new barriers, removing some of those barriers. On the first question, you're very, very kind, and I thank you for your remarks. I'm an advisor to the president, so my job is to sit in Washington and serve our president and give him the advice he's asked for on technology, data, and innovation, its implications for both economic growth and on improving the lives of our population. So my job mostly is to advise on policy. My hope is that partners like the New America Foundation, who've webcasted this, might make tools like this available. But I'm not so sure I'm the guy to do roadshows. But you're very kind to say that.
On that note, for anyone watching online, if you go to McKinsey.com, the report Growth and Renewal, Retooling America's Economic Engine is available right now, published today. Yes, other questions? Third row here.
James Sang, do you have any estimates for what the impact of the smart platform strategy, if it works, will be on both government and private headcount in the healthcare industry?
Gosh, I don't. But one of the things that, again, first principles, what do we ask our innovative economy to do in healthcare today? Billing and scheduling. That's what we reward. And so if the engine of innovation and entrepreneurship can shift towards clinical care and outcomes, because that's part of our reward system, that matters a heck of a lot more from my vantage point than any technical introduction. One other piece, which I didn't quite emphasize in the healthcare story, we launched this week healthdata.gov. We have spent billions of dollars in the history of our Department of Health and Human Services collecting statistics on health indicators throughout the United States. In fact, Bob Kocher at McKinsey helped design this program that's been executed by my dear friend and colleague Todd Park, the Chief Technology Officer at HHS, who is my accountable partner on issues of open government at HHS. We believe if you combine all of these forces, the payment incentives, the wiring up of the nation's healthcare sector with tools like the smart platform, but more broadly the incentives we have to wire up the nation's healthcare to achieve meaningful use, and this third dimension of making data more accessible, we think a new market will be built repurposing information. So I'll give you an example. If you're a primary care doctor today, and I have many in my family and in my friend circle, on what basis do you decide how to refer a patient? What information do you have? You have relationships, history, trust, maybe a golf partner. But if you had an ecosystem that actually had you think about the value equation, what questions would you ask of the data? To what extent might my referral lead to better outcomes for my choice? Which providers provide that kind of result? How can I provide feedback loops to ensure that they're delivering on what they're saying they're going to deliver? Wow. I don't know if there's a marketplace for that kind of information service today. Yeah. But you shift these incentives, you better believe that kind of tool will be made available. And what have we done in the Affordable Care Act? Provider quality, transparency is now part of our rulemaking. We have much more information about insurance products and how they operate. So just think about this as a mosaic, right? If I came to you and said a simple technical platform is going to be the answer to productivity in health or education, you'd laugh at me. But part of this larger story, I believe it's going to make your presumptions, we're going to blow by those assumptions because it's good for the American economy, and I think it's going to happen in our program. One or maybe we'll last, but you have to tell me when you get to pull the mic or whatever. Are we already in overtime? Are you delaying your next thing?
No. But as long as you can stay.
Okay.
I
get about
5 more minutes.
Yep.
Joe Minner, Committee for Economic Development. If you look through the anecdotes that you presented, there are instances where the federal government has played, where government has played an innovative role to help to develop technologies and techniques that don't exist. But there was also an anecdote where government developed an elaborate and expensive tool when there was another tool, talking about New York and potholes.
Sure.
Where there was another tool which I assume existed in the private sector.
It did not exist at the time, but sure,
okay,
keep going.
Okay. How does government perceive the difference between those two circumstances when government should take an active role in creating technologies and when it should identify and diffuse existing or potential private sector technology?
So this is a policy framework governed by OMB Circular A119 for you policy wonks. And it speaks to the role of the federal government in standards, which is not at the application layer, but at the technical layer. And it asks the question, should the government build its own or engage in voluntary industry consensus activities to generate the kind of commercially available standards that can then be adopted? And the American economy and the American success story is that we've bet heavily on the industry model as a methodology. What's new to that discussion has been, in the Recovery Act explicitly, a new challenge to think about how to modernize these laggard industries, as McKinsey described them. Health, energy, and education, by law. The Congress has asked NIST, which is the agency responsible for standards, to engage, under the banner of voluntary industry consensus standards, engage to help think through what the utility sector should look like in its communications with the customers, whether they be commercial or residential, what the healthcare system should do when it communicates across boundaries. And so we're in a little bit of an interesting model now, which is why I asked NIST to publish a request for information that's available right now. If you go to federalregister.gov and you search NIST's open calls for comment, we have an active request seeking feedback. What are the right models within the framework of Circular A119 that help us move and explain what we've done in the health examples and others, but putting a policy framework around this. So your input into that process would be extremely valuable. Now, to your more narrow question about government IT and whether we should be buying large-scale integrated systems or engaging in more nimble and open development frameworks, I think you could see our actions clearly. We spend $80 billion a year in IT. We're not going to shift that elephant overnight. But my colleague, the CIO, who's accountable for overseeing that massive portfolio, has introduced innovation after innovation to try to move our system to more agile development, standards-based and data-driven, as opposed to, let me solve world hunger in a single application that's going to take 10 years to build and we forgot why we wanted it in the first place. So look at where we are introducing new technologies. The president in the health insurance law has called for states to build these new health insurance exchanges. Over the next couple of days, you'll see the first grant recipients of early awards that would allow states to build those applications. And if you read the grant announcement and the requirements, we explicitly emphasize reusability, modularity, and the tools that went into that second example, which was the city see-click-fix model. So we are, in policy terms, shifting this elephant. We have a long ways to go, but we, in our new introductions, are defaulting to that as the way we're doing business. And you should respond and say, no, that's lame, you should do it better. We need input. This is an iterative process, but we're moving that machinery forward. Maybe one more, then I got to race. Go ahead, please, or whoever. You pick.
Please wait till the mic arrives. Go ahead.
Hi. I was intrigued by your opening anecdote that when you were in Virginia, there were actually no federal government metrics.
There still aren't.
There still aren't. Well,
the
that
Bureau
was
of whatever, I forgot which division. Labor Statistics. In 1985 or something, stopped, it was early 90s, stopped measuring productivity in the public sector. In part, to be fair, economists really don't know how to measure outputs and inputs in the public sector. So I was a bit glib when I was making reference to the fact that we didn't have metrics. But I'm sorry, you had a question.
Well, my question was, are there movements afoot to start keeping track of those metrics, particularly in light of trying to keep the quote-unquote laggard government sectors accountable for certain targets or productivity contributions to the economy?
Absolutely. And so my colleague, the Chief Performance Officer, Jeffrey Zients, who parenthetically was my boss for 10 years at the advisory board studying productivity in healthcare, has adopted a management framework for the president that emphasizes results. And so we've got a program. It's hard to be glib about websites, but it's just an easy way of describing this. We will be describing in a program called performance.gov key outcomes measures for our federal agencies. Now, one of the insights coming out of the Virginia example was you start by tasking the agencies. In Virginia, we said, define one measurable transaction or productivity measure. My favorite was the DMV. The cost to process a vehicle registration renewal. Okay? It turns out, and I'm going by memory, so be careful on quoting me, but you can go visit virginiaperforms.virginia.gov and get the data. If you visit a DMV in person, it costs roughly $8 to process a registration renewal. This is considered a low-risk transaction and something that can just as easily be performed online. The online version costs about $2.50 when you take into account the back office costs. So what the governor did, then Governor Kane, is he directed the DMV to establish a program that would migrate people to the online channel or phone channel or a DMV select channel, which is a distributed model. We had these alternative channels that were lower cost. And so we did a program where you get $1 off your renewal fee if you do it in these more cost-effective channels. And so we're seeing the results bump up. Now, I left by the time this program implemented. I left to join the president. So I haven't followed it as closely as I would have when I was there. But it's a sort of a tangible example. Now, the problem with that is that it's a great measure for the DMV, but for the economists, they can't turn that into like an aggregated measure for the state, although I've asked 100 billion times for someone to develop this methodology. So we're taking the track in the Obama administration. Let's measure results and outcomes. We've got performance goals for the agencies. The president called for 3 high-priority performance goals for each federal agency. It's in the budget that was introduced. Of course, it doesn't get a lot of news, but it's all there. And when we launch performance.gov, you'll see much more sort of user-friendly ways to access that information and to hold us accountable. Thank you so much for your time.
Aneesh Chopra, Chief Technology Officer of the United States. Thank you.